Thank you, thank you. And for my next act, how I became a grandfather. That's something to, I became a grandfather a week ago. We thought it was going to happen during the BRMI Conference, and thankfully it happened a week early because I was supposed to fly in around this, but it reminds me of the story about Mary in the square in Dublin, and the parish priest is walking by, and he said, "Oh, Mary, dear, how are you? Are you married?" "Yes, Father." "Any children?" "No, Father." And he says, "Well, I'm on my way to the Vatican, and I'm going to light the fertility candle for you." And a couple of years go by, and he's walking through the square again, and Mary is there. And the parish priest said, "Mary, good to see you. Are you married?" "Yes." Any wee ones?" And she said, "Well, Father, we have 2 sets of twins, and I'm pregnant." "And where's your husband?" "He's on the way to the Vatican to blow out the damn candle." Okay, but it's great to have children. It's great. I mean, it's another dimension. I'm a grandfather for the first time. I know everyone said, "Oh, it's a great feeling," and the best thing are those red lights on Sundays that you see, and that's the tail lights of the parents taking them home after you got them worked up the whole weekend. So I just am going to talk to you about this. There's been a seismic shift in our understanding of health and disease in the last 20 years. As a matter of fact, the American Museum of Natural History in New York has a whole exhibit, which if you're ever up, it's a great one to go to, called the World Inside Us, the world inside us, secret world inside us. And it's kind of like a Jacques Cousteau adventure of the human microbiome. A lot of interactive exhibits, but the curator of the museum calls the emerging understanding, this new science of the human microbiome, to be a Copernican revolution, just like when Copernicus discovered the Earth did not surround, was not the center of the universe, and that we revolved around our sun. This is the understanding of our microbial world. 100 times the 100 times the genetic information from our microbes than our own human cells. It's really interesting that in the world of bioregulatory medicine, the bioregulatory effect of our human microbiome has redefined our humanity. And I started to really meditate on this for a while about how the bacteria, the world was covered with, scientists agree, the world was covered with a microbial slime, several billion years ago. And in whether you're a creationist or an evolutionist, and I believe there's a creator behind the creation, and if you look into the ancient Hebrew text, it doesn't say God took from the dust of the earth and breathed his spirit into it. It says in the ancient Hebrew, in Genesis, it says God took from the slime of the earth and breathed his spirit. And there is a whole mitochondrial theory that the mitochondria and the bacterium, same shape, size, they divide the same, and our genetic code is in our mitochondria. So there is this nucleus and cytoplasm that surrounds that, but it is sort of a magnificent understanding of how we possibly came to be on this earth and how these microbes run us, we don't run them. So it's really changed everything and it's changed everything in the mouth. I spent the last 20 years of my life not just doing dentistry, but researching the oral microbiome and getting a better understanding of how important this community is and essential for our life. It protects us against deadly environmental pathogens. It actually makes it very inhospitable. This is one of the reasons why probiotics don't work in the mouth. Prebiotics do, probiotics don't. Prebiotics were tried as far back as the 70s in the mouth, lactobacillus, and it's gotten kind of, thanks to the yogurt companies, it's gotten popular. to try probiotics in the mouth again, but there has been not one scientific study that showed an efficacy of probiotics. Why? Because if probiotics work, I like to say conbiotics, like, when you eat a bad hamburger and that has salmonella, it will wipe out your gut microbiome, but it really has relatively little effect in the mouth. And so the mouth makes it the oral microbiome makes it very inhospitable for any foreign bacteria, good or bad, to set up shop. And it has an amazing regulatory function. It's an essential component of digestion. Very, very big area of research right now is our salivary immune system. Saliva is the lifeblood of the mouth. And I should say that a lot of this understanding only came about in the last 18 to 20 years because of some very sophisticated diagnostic tools we began to use, like confocal laser microscopy, atomic microscopy, fluorescent probes, and things like that. So the way we used to study the oral microbiome is we'd scrape this thick, smelly, sticky film that forms on your teeth in the morning, and we stick it under a microscope, and a lot of holistic dentists love to do this. They scrape this off the teeth, they put it on a slide, stick it in the microscope. You see all these bugs swimming around, and a lot of them are nasty, and they're spirochetes and all kinds of things. And this thick, sticky, smelly stuff is basically an unhealthy expression of the oral microbiome. So it's not that these bad bugs flew into your mouth and set up shop, and we've evolved from the idea that there's all bugs are bad, the germ theory, to this good bug, bad bug, good cop, bad cop, good bug, bad bug thinking. And so let's throw more good bugs in. That's sort of the probiotic approach. To now understanding that bacteria are like people, or we as people are really like bacteria, because we live in communities. We actually get together. We're organized. We do things. We pick up the garbage when we're in a good environment. We get, the milkman comes and delivers the milk, and the garbage man comes and picks up the garbage. And it's amazing, as I will show you, that these regulatory functions happen in the mouth in a fantastic way. And I forgot to say that oral health, and as I'll show you in my talk tomorrow morning, in the mouth-body connection, oral health is the 800-pound gorilla in the room for the wellness movement. So I have, wellness doctors, who are treating every aspect of the body and never asking patient what they're sticking in their mouth, what they're maintaining their mouths with, and they themselves are even brushing with poison toothpaste with triclosan and other things. So. We know now that what we're looking at here is an intelligent semi-permeable membrane, and it really does some amazing things. And what it's all about in this matrix, in this chaos, it's all about homeostasis or balance. And what does that look like in the mouth? It looks like this area right here. The oral microbiome, when it's in a state of homeostasis, is a thin, clear, odorless film, and your teeth feel squeaky clean. You don't even know it's there. Fortunately, and by the grace of God, we've not successfully nuked it, or we would have unleashed ecological Armageddon. And we tried really hard. I mean, we have gotten into, and it's interesting, we've tried with natural approaches like tea tree oil toothpastes. There's some of them, Desert Essence or one of them. And we've tried with chemicals like triclosan and chlorhexidine and all these other things. But we haven't really got there. But what happens here, and I want you to take a picture of this in your mind, is to the left is this. This looks complicated, and I'll explain it. This is my favorite slide. This is my favorite page of my book. And balance is the center of this target, okay? The circle in the middle is the host resistance. The larger the circle, the healthier you are. So that if you are moved, if you go to a big Italian wedding and you're drinking lots of wine and pastries and sugar and everything else, this target will shift. It will move. It will move probably to the right, and because there's acidophilic bacteria that cause an imbalance. And so you have Streptococcus mutans bacteria starting to get crazy and party. There's acid-loving acidophilic bacteria. And so this circle will move a little bit toward here. But because it's so large, getting back to balance is a lot easier. So our job in the mouth is to get you to have this big circle in the middle. To the right is what happens when you get that thick, sticky, smelly film. So to the right is this. This is called a hypertrophic biofilm. And to the left is what we see with chemotherapy patients and radiation patients, people that do oil pulling like a regular practice. I'm going to talk about all these different fads. And oil pulling, I find it very amusing because it actually is a great way to clean your mouth on a short-term basis when you have this thick, sticky film. But if you do it over and over and over again, you don't just get to the middle here. You get to what's called an atrophic biofilm. So we know that the biofilm in your stomach is about this thick. And the biofilm behind your ear is more like a desert. And so these, and by the way, the word microbiome is a fancy term that Josh Lederberg came up with in 2002 with the development of the Human Microbiome Project with the NIH, and it's a great term because biofilm doesn't sound as good as microbiome, but you'll hear me use it interchangeably. But the word microbiome was invented in 2002, so only 15 years ago. To the left, this atrophic biofilm, we commonly see acid-base reactions are generally hard tissue, it's teeth. And we see root tooth sensitivity here. So people that do a lot of oil pulling, and I had a few patients come in, and they're super athletes and yogis and everything, and they love the idea of oil pulling because it's Ayurvedic and it's all. I mean, I had trouble getting my patients to brush their teeth for 2 minutes. They're oil pulling for 20 minutes. It doesn't make sense. Something's wrong with that picture. So what we see in an atrophic biofilm are ulcers and burning mouth, and that is nuking the biofilm does that. So tea tree oil toothpaste will do that. Brushing with Colgate Total, the #1 brand of toothpaste in America, which triclosan has just been banned by the FDA for underarm deodorant and Lysol spray and everything else, but somehow Colgate got a pass and they didn't ban it on stuff you stick inside your body and your mouth. But secretly I heard that Colgate is removing this from their, and they're coming up with a new secret product. And so we have atrophic and hypertrophic. It's all about the balance in the middle. This is the part that's really fascinating, what the oral microbiome does. It actually is exchanges with the structure in which it's set. So it will bring minerals, ionic calcium and phosphorus from your saliva to your teeth. The bacteria remineralize your teeth. Okay, we look in the gut and it's making neurotransmitters for the brain. So neurotransmitters for the brain made by bacteria in your gut. Oh, so we don't need Prozac, I guess. So all those psychotropic drugs are working up here and it's really over here. But I'm sort of preaching to the converted in that world. In this world, it's interesting that if the microbiome is in balance, it's a storehouse of minerals and ions. And when there's a deficit, it results in a low pH and demineralization. All of this, the bacteria regulate this in the mouth. And tomorrow I'm going to talk to you more about why this regulation in the mouth is so critical to the health of the entire body. So what we look at here is the saliva bacteria dental complex, Sighalo microbial dental complex. Now this blob over here is the microbiome, and it's high biodiversity, neutral pH, and it's super saturated with all kinds of minerals. And those minerals are taken from saliva. And when it is in a state of balance, you have remineralization. See this acidic here? That's how we start to shift this. And we see demineralization occur. So remineralization, yes, teeth can heal. We just really weren't helping that too much. But Dr. Weston A. Price, and I'm a member of the Weston A. Price Foundation, I happen to think he was a genius and way ahead of his time. There should be a statue to him at the American Dental Association. He founded the research arm of the American Dental Association, but he's also the Charles Darwin of American nutrition. And the things that he postulated, even in the diet, and he did this whole anthropological, how many have read Nutrition and Physical Degeneration? That was 1935 or 1937, 1935, I think. He was writing that. And in 1917, he was lecturing to the American Dental Association in St. Louis, and he was talking about infections, focal infections in the mouth, and the effect on the body. And they were laughing at him. That was outlandish, that a dental infection would cause an infection in the body, that it would be this whole oral systemic link he was postulating in 1915, 1917. And I have some of the papers he wrote of the speeches he gave, and it was very, very interesting. But so far ahead of his time in terms of, he was postulating that teeth can heal. And just like people can heal, like healing is this just amazing. I'm always amazed when I do a surgery or treat a cavitation, and I see the patient and I see the healing that's going on, and that whole energetic process still amazes me every day, which is why I love to practice. The oral microbiome controls the balance of molecular oxygen and ionic oxygen. Molecular oxygen, good. Ionic oxygen is really like free radicals. And what ionic oxygen does down here is this is where we see gingivitis happen. So ionic oxygen, in order to, unbalanced microbiome, the bacteria secrete a radical or ionic oxygen, free radicals, right, in order to poke holes in cell membranes and get at the cytoplasm. And that's where the bacteria are unhealthy. So I use the analogy that at 8 years old, my dad took me to the area in East New York, Brooklyn, where he grew up, where there was beautiful brownstones, and it was this beautiful, robust, diverse community of Irish and Italians and Jewish and German and just about every nationality. And they had these brownstones, and everybody behaved, and then the environmental conditions changed. And when I was there at 8 years old, I was like, get me out of here. There were, drug dealers on the corners and gunshots and cars on fire, no tires and everything, all this stuff going on. I was like, Dad, how did this happen? And he was like, welfare. This is welfare. But he couldn't really explain it in terms of real economics, but the community, the environment changed. And, it's interesting because the drug dealers were in between the alleys of the brownstones and all, and I said, that's kind of what goes on in the mouth. The brownstones are like our teeth, and when the environment changes, that's when bad things start to happen, and that's when these same bacteria that keep us alive, are starting to create gingivitis. So it's kind of like good bugs, bacteria like people. They behave well when the environment is good. They behave bad, and they actually flip a pathogenic switch. And they vote. It's called quorum sensing, and we see this. And brilliant TED talk by a good friend, Dr. Bonnie Bassler. She's the chairman of microbiology at Princeton University, and I went down to see her because I was working on prebiotic oral care formulas that don't try to manipulate the bacteria, because it's farcical to think we can manipulate bacteria. What we need to do is, as as my friend over here, Steve Carlson, came up with the slogan for my prebiotic toothpaste, make peace with your microbes. We need to, as Rodney King said after LA was burning and all those riots and everything, and he came on, this guy was just kind of totally, it was this huge, and the LA riots, when that happened, he came on and he said, can't we all just get along? And that's really what we need to understand in the world of bioregulatory medicine. So it's a pretty complex structure, this oral microbiome, and it's pretty stable. But the things that we were studying as biological dentists and holistic dentists for years, we were studying planktonic bacteria, these little streams that fly off over here that form that thick, sticky plaque that you just you got to kill it because it's bad. And if we were successful, it's like killing a coral reef, protecting an island. So again, in an unbalanced state, you start to see aggressive, opportunistic organisms appear. So yes, spirochetes don't live in this kind of environment. This is mostly aerobic. But then you have these, you go to a change over here in the hypertrophic state. There's a change in the nature of this community. And that is that the aerobic layer gets sort of stomped out, and you have bacteria that normally behave, that are large in population, and they're facultative anaerobes, like Fusobacterium nucleatum is one of the nastiest bugs when it's pissed off. It's really, really nice and behaves very well and maintains actually a lot of the architecture. It's one of the largest populations that we see. But everyone should know that our oral microbiome is as unique as our thumbprint, which is why in bioregulatory medicine, the individualized approach of looking at everything. And even though I even saw commonalities in my wife of 34 years with Lori, who was here, that there's differences. They don't look the same. They've had different things happen, but there are commonalities. And so in the oral microbiome, we have anywhere from 600 to 800 species we've identified so far, 6 to 10 billion bacteria. We see commonalities but differences. So it's as unique as our thumbprint. And that's part of why the individualized approach is so important in assessing, diagnosing, and treating. So again, here's Fusobacterium nucleatum. It was a commensal community organism, and it turns into a pathogen. And when it is a pathogen, it has been linked to adverse pregnancy outcomes, preterm birth, stillbirth, preeclampsia, GI disorders, colorectal cancer, inflammatory bowel disease, appendicitis, cardiovascular disease, rheumatoid arthritis, respiratory tract infections, Alzheimer's disease. So everything from Alzheimer's disease to colorectal cancer has had components of bacterial pathogens from an unbalanced oral microbiome. And that is why we never, in this country, dentistry became this, they were the goofy guys on TV shows on TV, and they were off in their own little world. But I think the biggest disaster has been when we separated dental schools from medical schools. Probably the bigger disaster. Yeah, thank you. If you go to Europe, that they look at you like, what? Why would you do that? And the reality is that what that created was this, isolated, and even the subspecialization of medicine has done the same thing. But we're changing that, and that's why I'm very excited about BRMI. That's why I'm really excited about the center that's being built in Providence. There are some really exciting things that we are on the precipice of. So again, this is a commensal bacteria, and when it expresses itself pathogenically, when we're trying to kill it, they took plaque off the tusk of a mastodon, frozen in a glacier. They took they took plaque off the tusk of a and they put it in a petri dish at body temperature, and they saw bacteria start to unfold, and they called them persister bacteria, and they exist in your mouth. They kind of hunker down, they go into hibernation, and they flourish again. So we're never going to, thankfully, we never can eradicate our microbiomes, and there's a good reason why. They keep us alive, and they make us who we are. They even, I had my mentor in the microbiome tell me, the bacteria choose who you're going to marry. And I was like, what? The bacteria in your body choose who you're going to marry, like who you're attracted to, what those unique, chemical, reactions are. Like I like blondes, I like brunettes, So it's really so fascinating. Some of the stereotypes are so interesting how they could be bacterial in origin. So to kind of sum this up, and I was on Martha Stewart's show in 2008 when I was in the middle of all this, and she said, "Oh, I understand you're working on new advances in oral care." And I said, "Martha, toothpaste was invented by soap makers 100 years ago." I said, if I said something bad, my mother said she'd stick soap in my mouth, but I was brushing with it already. It's like and then everybody laughed, and I said, the real advance that the drum that I'm beating is it's time for doctors to get out of the chemical business. Okay? Well, here we have glyphosate, and the glyphosate of the mouth is triclosan, and which I'll get into, by the way. I'm going to get into that. It's so insidious. And I said, what I'm promoting is organic gardening for the mouth. And I said, that's what I know. That's my area. But I know that mouth is really connected to the rest of me. And so we really love to see this. This is a healthy oral microbiome. What happens when you use glyphosate and pesticides on your grass? What are the first organisms to reappear? And those are the weeds, and they get tougher and tougher and tougher. So that's a Bitmoji of me. I did that. Anyway, that's my Bitmoji. I was actually laying on a chase lounge in Ravello, Italy, and I had the International People magazine, and I came to this ad after I've done 15 to 18 years of research on the oral microbiome, and it says, eliminates 15 times more bacteria to improve the health of your mouth. So this is like, and I said, that's when I said, I just got up, I couldn't stand it, that they allowed, Colgate allowed an ad like that, this is just so misleading that using something like this to improve the health of your mouth, you're nuking a coral reef protecting an island. So, but I think Kelly Ripa probably got a couple $1 million for doing that campaign, and those teeth are photoshopped. Veneers. So, I mean, I don't really, my mentor gets really, Stephen Moss gets upset, but I do have to say that this is known, that the leading brand of toothpaste in America, so the way I began my microbiome research 20 years ago was in 1998, my mentor, Stephen Moss, was the head of growth and human development at NYU. He's a DDS MD PhD. He actually did the original fluoride studies in Newburgh, Beacon, New York. So it was interesting, his whole career, and he's brilliant. And he came to me, he was on the scientific advisory board for Colgate. Colgate gave him about $20 million to find out how to really kill plaque. And they were going to use this triclosan, which triclosan was banned by the FDA in the 60s or 70s. And then Colgate did 6-month studies in the Philippines on it using a much lower level. And somehow they got, after 7 years of petitioning the FDA, they got approval. they started experimenting with this to see how well it killed plaque. And Dr. Moss went back to Colgate and said, no, you don't want to do. They had studies done at the University of Montana, PJ I think it's PJ Marsh in the UK, PT Marsh in the UK, Forsyth Institute in Brooklyn, in Boston, and a number of other places. All the research came back, you don't want to do this. It's not only ineffectual, but it's harmful. And Colgate said thanks, and they fired him. So when I brought him what I was working on, I was really looking at it from the perspective of it kind of the mouth being nutritionally deficient, trying to take oral care from a detergent product, right? This was made by soap makers. We had soap for your hands and your hair and clean your mouth. And take it from that and move it into a nutritional. And I read a study from a Japanese dental researcher in the 1970s who found that he biopsied diseased gums and found they were deficient in coenzyme Q10, vitamin C, really important, and coenzyme Q10. So I started playing around with that with vitamin E and selenium and putting in cranberry seed oil and other things I didn't realize, but I was starting to create something that was prebiotic in action. And so what we found about triclosan, these are all the studies that came out. I'm going to give you 6. Indefinite afterlife in human tissue. Swedish studies found triclosan is 60% of women's breast milk, even years after the mothers had stopped using antibacterial products with triclosan to toxicity concerns. The body stores triclosan in fat cells. Toxicity is a common cause, as we all know. Inability to lose weight, yada, yada, yada. Triclosan is a powerful endocrine disruptor. Triclosan is associated with antibiotic resistance. Really fascinating about this, that triclosan is non-biodegradable. So when you spit it out of your mouth into the sink, it kills algae and fish in estuaries and streams. It forms dioxin in riverbeds. But the thing about it with antibiotic resistance is it increases antibiotic resistance to all antibiotics across the board, not just the antimicrobial triclosan. It forms carcinogens. This came out of China. It's funny, the Chinese have done some good things. They've got like 20 to 30 studies on fluoride lowering IQ in children, drinking fluoridated water lowering IQ in children. And then Harvard finally did a meta-analysis and confirmed these studies are conclusive that drinking fluoridated water lowers IQ in children. And it forms carcinogens, so it forms chlorinated tap water and triclosan form chloroform molecules. Chloroform molecules. Number one, this is what most of America brushes with. Triclosan is strongly linked to human disorders. They were looking at asthma, allergies, eczema. And then this was interesting, recently linked to cardiac and skeletal muscular weakness and disorders. So the state of Minnesota, anybody here from Minnesota? Minnesota was the first state to say, we don't want any of this crap in any products that are sold in our state. They banned triclosan across the board in 2015 or 2016. And then the FDA finally relented and pulled it out of everything except toothpaste. So I'm going to talk about one other one on the natural side, because this is another huge hoax that was propagated by primarily a lot of the research was paid for by a subsidiary of DuPont Danica, and a lot of studies done in Finland about this. Sugar alcohols were another pet peeve of mine. And, it's the new, we always try to come out with the methadone for the heroin. So, sugar, even Eric Clapton said sugar was more addictive than heroin and cocaine. And there's just really powerful receptors with sugar. And so we've had saccharin and aspartame, and here is the new darling xylitol, though this is now starting to go off the deep end. When we discovered that it can kill your dog, then we said, oh, maybe we shouldn't use it on people too. There were no long-term safety data on xylitol, but they just like that ad for Colgate, there are lots of ads for xylitol products as a natural sweetener. So here is xylitol, Xylan, coming from pretty little birch bark or organic corn cobs, but 80% comes from GMO corn cobs. Do not be deceived. And it goes through this really interesting process. This is out of an organic chemistry textbook of hydrogenation, hydrogenolysis, and then separation. Then they call it a high-value chemical. The reason why you get intestinal diarrhea and bloating and gas is because xylitol is not absorbed nor metabolized by the human body, and it's extremely disruptive to the gut microbiome. It's equally disruptive to the oral microbiome. But the reason they actually took its disruptive effect as good, and they called it anti-plaque, and they said, oh, it keeps the Streptococcus mutans from sticking, and it interferes with their ability to function, and da-da-da-da-da, as if that's good. And the reality is, it's bad. And this was in the Wall Street Journal actually last summer. And so now the FDA is looking at the human safety, of which there were no long-term safety data done on it. Again, just because it's natural doesn't mean it's good for you. Here's Dr. Mercola. He no longer markets this after I was on his podcast a few times. This has been pulled. But look at how many antimicrobials are in this one product. Tea tree oil. This is a terpene. This is a really powerful antimicrobial. Licorice root, antimicrobial properties, tulsi oil, and then xylitol. So in 10 years ago, it's a terrible picture of me, actually. But I look like Tony Bennett? I love that. I used to get Dustin Hoffman and all these other, like Al Pacino when I had a beard, and now I get like Tony Bennett. So my classmate, Dr. David Shuck, he and I graduated in 1983 from New York University. He is a great guy and a great scientist as well. And he and I enrolled in the first, sorry about that. We enrolled in the first master's program in New York City given by a Dr. Alan Pressman in 1983. It was a master's in holistic health, which was like voodoo in 1983. And my wife was like, we have all these school loans. Why are you going to this? And not only that, after that, I went to David Eisenberg's program in complementary and alternative medicine at Harvard in the 90s. And she's like, why are you doing that? I was the only dentist there. But again, we came up with this. So I have to tell you that this was part, this is a gift. I mean, I really didn't know why my product worked when I did it. And I don't want to seem self-promoting here, but I do. Stephen Moss told me, he said, what you're doing could save the world. And I laughed. And he's like, yeah, he said, if those son of a bitches at Colgate were successful in nuking the microbiome, it would have been, that's where he used the term ecological Armageddon. So someone was asking me what's prebiotic, and there's a lot of different types of components, like xanthan gum is made from bacteria, cranberry seed oil, and CoQ10 and vitamin C act in a nourishing the natural indigenous microbiome of the mouth. And so we started studies, and what we found in our first study, which was really short, and we looked at it, and we had a 27% reduction in gingival inflammation in 7 days, right here, above 25%. Colgate Total was saying after 12 weeks they got 22% reduction. I don't believe that, because I think it goes the other way. Long-term use really causes, we have a number of different triclosan-resistant bacteria in the mouth, and this was Sonicare and some other devices and different modalities. Then we did another study in Europe to stay out of the FDA here. We did a study in Europe under the direction of a Dr. Cornelius Parmentier who is a professor emeritus at the School of Dentistry at UConn. And this study was really interesting because it was only, there was 10 control and 10 patients using Revitin. And what we got in, this was 14 days with Crest ProHealth as the control. We had almost it's really close to 80% reduction in bleeding, but the reduction in gingival inflammation, this is a big thing. And what happened was these Dr. Platino and this Dr. Grant, Andrea Butti and Nicola Grande, they kept running out of the toothpaste. And so I said, well, we just sent them a case, what's going on? And I flew over to Rome to meet with them, and they started, I'm going to try and do the impersonation. They were like, this is a very, very good product. And I said, guys, where's all the toothpaste going? And they look at each other and they start laughing. They were like, well, I took it home to my mother and to my father. My kids use it, my wife. So it was very, very cute. But this is a guy who ran up to me in Atlanta at a program that I was speaking at, a functional medicine forum. And this was his periodontal chart. He saved it because in June, I gave a talk in Park City, Utah. And this was the periodontal chart with the bleeding marks and everything and his pocket depths. He was scheduled for periodontal surgery by his periodontist. And in September, he went back and he had 3 little spots. I saw him again, and this was his chart. He no longer, the dentist was flabbergasted. Well, what are you doing? And he said, I stopped killing the bacteria in my mouth with the stuff that you were giving me. And he actually said these went away. He has a perfectly normal mouth. And all he did was change what he was putting in there. And so the kinds of things we see when the microbiome is balanced is a thin, odorless, clear film. Sores like canker sores or even herpes outbreaks on the lip go away in a matter of sometimes overnight. And a lot of canker sores happen because of sodium lauryl sulfate, a really bad ingredient, but it's in all soap. It makes things foam up. It's a detergent ingredient. Bleeding stopping, this is really fast. Comforting ulcers, less sensitivity. That's the center of the target right there in the middle of the pie. This is a picture taken by Anita Daniels, who did our first study. She was blown away in 4 days. Just look at the gum tissue here and to here. So healing trauma faster. I have to tell you that I'm very proud of that. I really hope it helps to improve the health of billions of people. I don't think you can heal the mouth without understanding. I don't think you can heal the body without understanding the oral microbiome. I want to open it up for questions. Questions anyone has about anything. Anything. Oil pulling, clay, charcoal. Do you want me to address any of that?
Two things I would like to address. What about the scraping of the tongue? Does that upset the microbiome? And what do you think about the water pick, using that? Please.
Excellent questions. Scraping of the tongue scraping. If you have an unhealthy microbiome, tongue scraping is good because you remove a lot of those, that hypertrophic film that actually harbors, because it stamps out the aerobic layer, and you start to get, odoriferous bacteria, sulfur-causing bacteria and all that. It's so interesting that halitosis, or bad breath, is treated, they treat the symptom and not the cause, right? They camouflage it, they try and kill it and strip it off and all that. If you brush your tongue, like for example, if you use the prebiotic, Revitin, everyone take a tube, if you brush with it, you'll find that film on your tongue will go away. We start to restore that homeostatic state. That does not mean, I was on the Dr. Oz show about a year ago, and they had a whole thing because some guy came out and said, you don't have to use floss. Floss doesn't work. You don't floss anymore, which is the thing that everyone hated doing, because when your gums are inflamed and you snap that string between your teeth, it really hurts. And I said, it's not about flossing or not flossing. We do need to clean debris. We eat, we have food. And I said, not doing interdental debridement is the equivalent of being in New York City in July and the garbage is piled up on the side streets, and if it's not picked up or removed, pretty soon it starts to smell and the rats come out. And I said, that's a similar analogy. I like water picks for 3 reasons. One, it's great for eliminating surface debris. Number 2, I like the ability for it to improve circulation, and that's good, because if people, we have this very complex circulatory system in the mouth, and that blood helps to remove toxins and clean up. And the third reason is because we can also use it as a delivery system for things that foster a healthy microbiome. I am working on a rinse right now. Interestingly, the biggest thing about manufacturing an effective prebiotic rinse is you have to have, on a certain level, an antimicrobial ingredient for shelf life and manufacturing. So a lot of healthy mouth rinses use xylitol. So I'm with my formulation people and they're scratching their head. But we found that we came up with a solution, and the solution is actually with a hydrosol nanosilver that doesn't disturb the microbiome, but does prevent microbial overgrowth. So like colloidal silver and that. Yes? Who's up? Oh, I'm glad you brought that up. Erythritol is worse than xylitol. So erythritol, which has now been linked to esophageal cancer and a lot of gastric reflux, is absorbed but not metabolized. So the body lets it in and it's not metabolized. So I'm not a fan of any of the sugar alcohols. I think they all, but I'm glad you brought that up. So erythritol, everybody knows, Truvia. And the other thing about erythritol, once it's absorbed, it stays in for, I forget what the study was. It stays in the body for a very long time. So yeah, erythritol is almost a little more insidious because it gets in. Xylitol just disturbs everything, but it goes right through you. That's why they started making xylitol cupcakes and all this for diabetics and everything. They were using xylitol, and they just it's like huge GI issues. Stevia, it's interesting. There's GMO stevia now. It's like they find a way to just mess with the normal. I happen to like stevia. I put stevia. I was working with organic whole leaf stevia 20 years ago. So that's the only thing I use with organic essential oils in my toothpaste. But don't find stevia harmful. It's not a great sweetener because it is, and I think that I'm not a big fan of ingesting stevia. There are some studies that are coming out now that it can be disturbing, but it's probably the most benign. But I wouldn't use. I'd be careful about what type of stevia you use and how much you use. Like a lot of people like stevia in the coffee. It has a little bitter aftertaste is what I was going to say. Yeah, John?
Back to the microbiome. Do you know of any relationship between bacterial action and microbiome having a regulatory effect on tooth fluid dynamics, Steinman's work, and dental fluid flow?
It's very intricately involved in that. That slide that I had on the dental Sighalo microbial complex, or Sighalo dental microbial complex, very interesting how it does regulate fluids and mineralization. Very, very, and it's really, the bacteria do that. It's not, the saliva is sort of the bloodstream, but the organisms that are doing the work is the microbiome. And the thing I didn't point out is our microbiome is really, we were calling it a new organ system. The microbiome is a new organ system.
And I got one more.
Yeah.
Which I think is really important for now is, what about ozone use, both
Great question.
ozone use on the microbiome topically and injecting?
Great question. I'm sure you treat cavitations and all kinds of dental infections that we find. I think ozone, which is basically peroxide, needs to be, it's very effective because I think it has a much more beneficial effect. I looked at hypochlorite, peroxide, ozone over the years. My problem with the teaching of using ozone at a cleaning or a periodic maintenance visit of a patient and ozonating all the gums and all this as a general tonic is ridiculous. And it is basically nuking the microbiome. It's disturbing it. In an infection where there's a great imbalance, I think I use ozone in cavitations all the time, injectable, and I find that my ozone use is targeted. It's targeted. It is not a general tonic. So I do not have my hygienist or anyone ozonate the entire mouth. But I think it's very effective in treating individual infections. So
Do you think you get an upregulatory effect with ozone, as if ozone knows the difference between a good bug and a bad bug? So your microbiome with ozone use is still going to remain the microbiome that you want, but ozone.
remember, good bug, bad bug. Bad bugs are good bugs that are disturbed. And so what we're finding is we've tried to, I've actually had a major philosophical difference with Dr. Bassler at Princeton University. We sat down in her office and I was like, she's trying to modulate the communication between bacteria to kind of disturb how they talk to each other. So, it's a way of us kind of overcoming a pathogenetic state, which is a little of what you're getting into. And I'm like, what we really need to understand is that they've been around longer than we have, and we really kind of just got to help them, do their regulatory work to get back to a state of homeostasis. It's a big philosophical difference, and it's kind of a little bit of what you're talking to, where does the ozone go to the bad bugs and know that the good bugs are good bugs, and that is, we're so indoctrinated with the philosophy that we have to kind of straighten the bacteria out, and instead of the fact that the bacteria straighten us out.
So ozone use, in a way, it's still used allopathically.
Yes, I absolutely agree. Yes, that's exactly right. The concept that ozone is being used homeopathically is just not true. I have not seen any science, especially now, that ozone is anything but an allopathic application, which is, look, I'm not here, I don't practice as a Christian Scientist, and I don't, I do I try and use, my patients, I'll give them Argentin 23, which is a really, I think, a very high quality hydrosol nanosilver that instead of an antibiotic prescription, right, knee-jerk antibiotic prescription. But it doesn't mean that antibiotics, I'm not standing here saying that I would never prescribe an antibiotic again. But those were both great questions. Thank you. Yes?
As far as root canals, do you suggest maybe once a year getting an ozone treatment for or extracting the root canal?
If you need periodic ozone treatments for a root canal, you get the tooth out. Now, I am not standing here, and I know I've had major arguments with Thomas Rao, who, you go to Paracelsus, and they will extract 6 teeth in a row, and the patient goes out looking like a Canadian hockey player. So, and I'm like, you know what? There is a compromise. I use cone beam, and I really go over every case, and I let the patient know, we do not live in a perfect world. Staying healthy in this life is like walking through a minefield. And, we got to kind of get the mines one at a time. If we just try to scrape all the mines away, we'll blow everything up. I'm not going to blow up your mouth. I'm going to treat you on an individualized basis. I just had a patient from Russia come to my office in New York, and we went through I went through the most, in triaging her treatment, I went through the most damaging root canals. Like Lori had a root canal on a lower anterior tooth. If under a cavitation, which there may be, I don't know, one of my colleagues saw a cavitation, that tooth would come out immediately. However, the anterior teeth are the least problematic in terms of cavitation. Believe it or not, you know what the biggest source of cavitations, I do not prescribe. I mean, the research right now is that extraction and a future dental implant is more predictable, even from a conventional standpoint, more predictable than doing a root canal and da-da-da-da-da. Dentists used to think you do the root canal, the patient doesn't have any pain, the tooth is in their head, so that means we did a good job. And the reality is that's totally not true. Cavitations, G.V. Black, the father of modern dentistry in 1915, spoke about cavitations where there's not a fever, there's no pain, and there's no swelling. And it's there, and it's ugly. It is black goo in the jaw from necrosis of the bone. And I have dissections and slides to show that. I think I'm going to show a few tomorrow morning. But the biggest source of cavitations are wisdom teeth. Yeah, wisdom teeth. I just over and over and over. You see this ghost on the cone beam. And so this woman who was having all kinds of this is a young woman. She's about 36, 37 years old, all kinds of small intestine issues. And then she just was diagnosed with breast cancer. And she's 37 years old, and I looked in her mouth. She had cavitations in all 4 areas. She had 5 root canals, 2 of them on the upper first molars. And I'm like, you got to get cleaned up here, and we got to clean this up because, this is, and I'm seeing her on Monday. And I'm doing the worst cavitation. That's it, 1. And then we'll get to the others. But it's not like this idea that someone here, her daughter just had, her daughter just had 4 wisdom teeth pulled because 1 was bothering her. And the dentist pulled all 4. She's in agony, infection, all kinds of other things because there wasn't a biologic approach. And I do have a protocol tomorrow, which I'll show everyone as well. Yes, in the back, Dr. Tung.
You mentioned oil pulling. You've had some patients that have had some kind of bad reaction. And I was just wondering, because this is kind of my feeling too, that a lot of ingredients that people are using are not so good. So do you think it's oil pulling per se, which is really an ancient Ayurvedic practice?
I know.
Or is it the ingredients specifically?
There are so many great things that came out of ancient systems of medicine. Even, whether it's Chinese medicine, Ayurvedic medicine, great wisdom that came out of that. The purpose of oil pulling is, and I think it's a healthy way to clean your mouth. I just don't think, what we've done is we said, oh, this is good because it has, basically, the oil has a lipophilic action of removing plaque, hypertrophic biofilm from between the teeth and around the teeth, and it does it well. And coconut oil is it's one of my superfoods. It's loaded with good stuff. Organic coconut oil is great, but it's typical in especially in our culture where we take a good idea and we take it to a bad place where it just gets bastardized and done, and so now we have all kinds of coconut oil that's not good for you, and then we have MCT, and then that is good. The coconut oil pulling in and of itself is not bad. It's in my opinion, because of the detergent action and what I've observed in my research, is that if you continue to do it, it will create an atrophic environment. So you get past the middle of that target and you go all the way to the left. I just, yeah.
Yes. The Ayurvedic approach is not to use coconut oil.
Is sesame. Sesame, I know.
Another saponific.
Right. And that may have a less atrophic effect. I'm not sure, and I didn't do any research on that. I'm just seeing that coconut oil has become very popular because coconut is super, and people are thinking that it's doing something magical because it's nutritional and da-da-da-da-da, and it's really just a very non-toxic detergent cleaning action. And sesame oil may not have the viscosity or the atrophic effects as coconut oil does. So I do agree with you. I just want to say two other things about charcoal and about clay, which have become very popular in dental products now too. The idea that charcoal is a powerful binder, and so they said, well, it's a binder, let's bind toxins in the mouth, without understanding this important architecture of the oral microbiome. Using charcoal on a regular basis, and I use activated charcoal when I remove mercury with my SMART protocol, which you'll hear about tomorrow. I use activated charcoal when I am, by the way, I treat BPA composite. Patients have old composites. I know those composites, those plastic fillings, some of them have as much BPAs as a plastic water bottle. And so I treat that as if I'm treating mercury. I use a rubber dam. I use activated charcoal. I have the patient, I break open a capsule, I have them rub it around their mouth. But I don't have them brush with it because, again, you will disturb that microbial homeostasis and create an atrophic environment. Bentonite clay, the same thing, binding to toxins. So there are places where these are good, and then we take it to a bad place by trying to make a new product out of it. And yeah, the first one I saw is you back there.
Questions. One, we see this kid with the hypertrophic tonsils. I'm wondering if the Revitin has any effect on reducing that lymphatic swelling. And also, the second question is, in order to prevent the wisdom tooth removal, which is so common, what sorts of thoughts do you have about that?
The first part was, does it have this effect on the microbiome and the tonsils? It's interesting, It actually, I've been experimenting now in using it and swallowing. I mean, we had a thing where we wanted people to brush and swallow, brush and swallow and have it, because it is prebiotic in nature, but no, we haven't done any studies on that. The other thing I wanted to say, you brought up the second point, was really, what was the second question? Yes, a protocol for wisdom teeth extraction. The old idea of your child is 17 years old and the wisdom teeth are half in and half out, take all four out at one time. I used to think, well, yeah, why put them through another surgery and why not just do it, especially there's a lot of oral surgeons do, IV sedation, so you just have one time and get it all done. I've completely, I haven't recommended that in ages. I think there's many ways to treat that conservatively, but wisdom teeth are very interesting. Actually, Weston Price spoke a lot about that the civilized diet not only resulted in multiple dental problems of that generation, but this epigenetic influence on subsequent generations where the jaws are malformed, there's not enough room for teeth to come in and all this kind of stuff. The thing about wisdom teeth is there's a lot to explain, but they can come in all different ways: mesioangular, distoangular, horizontal impaction. So there's some, you actually see the second molar here and the third molar is like this. That's a horizontal impaction. That tooth is never going to erupt. And so that tooth many times we see a communication from the oral cavity down and around there. And if there's any imbalance, those pathogens love to hang out down there. We even have found Lyme spirochetes in cavitations of removal of wisdom teeth. So there's lots of circumstances that have to be evaluated prior to removing a third molar. And I would really take a very strong bioregulatory approach, that is, treating it on a very individualized basis and not just blanketly taking it out immediately, like your daughter had.
And I
Yes.
have a question
Sure.
about my daughter. What are some options on healing cavities naturally? Because with
Excellent.
yeah.
Excellent question. I think the first way we do that is we need a homeostatic environment. Nutrition is a cornerstone of that. I think there's not enough fatty acids. There's not enough fat, period. And you know, he used to talk about Weston Price. One of his favorite was cod liver oil. And doesn't taste too good. But actually, I'd love Dixon's opinion about that. He's a hybrid of doctors, from dentistry to naturopathic medicine. But anyway, yeah, there's a lot of diet and nutrition involved in a tooth being able to remineralize. Remember, we're fostering that dento-sighalo microbial complex. And that's this very interesting complex. John?
Steinman's work on fluid dynamics on the tooth, right before he passed, he was pointing his fingers towards pesticides causing tooth decay because it's an endocrine disruptor between the hypothalamus and the parotid gland. And that parotid gland secretion is necessary for the regulation of the fluid dynamics inside of the tooth. So you've got this microbiome thing with what lives on the surface of the tooth, and is it being absorbed into the tooth, or is the tooth sweating, pushing its fluid dynamic out into the mouth?
And that's absolutely right. And that is where.
A lot to do with pellicle formation too, the biofilm on teeth. Ralph Steinman's got some great research on it.
All of the research, the cutting edge research, is moving in the world of salivary flow and salivary function, salivary dynamics. And saliva is something that's been severely disrupted in our diets, in our environment, and in our health. There's lots of drugs we take that affect salivary function. And so that's excellent. Thank you, John, because that is the hottest area right now. One. Do I have time? One more?
Hi. Based on what you're saying, it sounds like bacteria need to stay alive in the mouth. What about all of these things that were offered then to the regular dentist, like Listerine and mouthwash? Do you not use any of those?
Yeah. Listerine has gone through so many machinations. My mother loved Listerine, and she was obsessed with teeth. I mean, 2 of her children became dentists. My mother was a huge Listerine fan. Anyway, and it was Mom, it burns. And it was like, that means it's working. And that's what they did. No, Mom, it was like 70% alcohol. That's why when they did this whole alcoholism campaign and they pulled the booze off the shelves in Russia, the mouthwash disappeared in like 5 minutes, in all the stores. So the reality about Listerine is that it is really, it kills everything. And when I was coming out of dental school in the early 1980s, a study came out that got released before the internet and everything, that Listerine was linked to oral cancer, and it was the alcohol content. And so there's been a big trend to try and pull all the alcohol out of mouthwashes, but it's a bunch of crap. I mean, mouthwash, when we're conditioned to having, everybody's like, when are you coming out with a prebiotic mouth rinse? I'm really doing it because, and then this stuff, Plaques came out, the pre-brushing rinse. And that was pure alcohol. So I was like, if you're going to pre-rinse, rinse with Angel's Envy over here, right down the block. I'm sorry, rinse with Woodford. That's going to do a lot. You're doing the same thing. Good. But the funny thing about a lot of these oral care products, there was really, a lot of them came up by marketing people. And the idea behind Listerine was from the original germ theory. So they put everything in there, and there were like really powerful oils in addition to high alcohol content that was literally napalm for the oral microbiome. So the answer to your question is no, Listerine is not a good product.
Skip them out.
And actually, I love Himalayan salt because pink salt has so many minerals, trace minerals. So I even have patients rinse with some, Himalayan salt. It creates an osmotic gradient if they have inflammation and things like that. With a non-microbial essential oil, like the reason we have citrus, we have lemon and tangerine, they're the least antimicrobial. Peppermint oil nukes everything. Spearmint, wintergreen, clove. So this thieves, essential. I use it in my dental operatories in the winter. I have thieves, the essential oil by the young people. And it has clove and all these antimicrobials that kept the thieves in the Black Plague alive. That's how it got its name. Any other questions? You used or you quoted? Okay. Let me just get one other person.
Can you comment on carbonated waters and how that is affecting?
Okay, so carbonated waters. I had someone was having runaway decay, and she was, super fit, but she lived on carbonated waters, Perrier, and all this stuff, and so carbonation turns carbonic acid. Her pH of her saliva, pH of her mouth was horrible. I don't know if they're giving me a clue. Are they trying to get the hook? So yeah, carbonated waters create a very acidic pH in the mouth, which is very destabilizing to the oral microbiome. That's why carbonated waters can cause. With a dinner, no problem. But during the day, she had them on her desk. She was drinking carbonated waters all the time. And she's like, there's no sugar. But it's not just sugar that creates an acidic environment. It's the carbonation. John, go ahead.
About cavitations, jawbone cavitations, do you think that if the reason for the cavitation is because the periodontal ligament is left behind and the body has no mechanisms to dissolve or
Yeah, it becomes a necrotic.
so you don't get angiogenesis in the bone marrow?
Exactly.
Or you think it's the body can't build bones, so maybe you got a gut wall, you got an assimilation issue.
And one more.
The microbiome
Yep.
is off, so you got all of the above.
All of the above. Answer C. Answer D. All of the above. All of the above. And that's what I found. But those are all kind of like the perfect storm, in that area. Thank you very much. There's more tomorrow morning.